To set the stage for today's discussion, it is important to understand how this change fits into PSEG's total reward strategy. Over the next 2 years, Human Resources is embarking on a deliberate journey of modernizing the grid with the end goal of improving our customers' experience. Customers include employees, past, present, and future. Some of the enhancements we have made to date include the introduction of a new 401k provider, Fidelity, offering better service, technology, and lower fees, and a new life insurance provider, The Hartford, offering better pricing and streamlined administration. There will be more to come, including improvements to stock plan, health and pension benefit administration, along with access to new communication portals. Today, our focus is on how we will provide retiree healthcare benefits, medical and dental, to retirees and their dependents once they become Medicare eligible, typically at age 65. There is no change to under age 65 retiree coverage. We are going to start our discussion today reviewing PSEG's retirement eligibility rules. Select Line and Choices employees are eligible for access and subsidized retiree healthcare coverage. A Select Line employee is a non-represented employee hired before 1996, and a Choices employee is a represented employee hired before 1997. This group of active employees represents approximately 25% of our total employee population. To receive access and a subsidy to retiree healthcare, you must meet both of the following conditions. Your age in service must equal 80, referred to as meeting the rule of 80, and you must have at least 30 years of service or be age 62. Benefits 2000 employees are eligible for access to retiree healthcare when they are age 55 and have 5 years of service. A Benefits 2000 employee is a non-represented employee hired after 1996 or a represented employee hired after 1997. At age 65, Benefit 2000 retirees do have access to the Medicare marketplace, which we will talk about more in this presentation. Healthcare plan options for pre-65 retirees are similar to those you have today as an active employee. Upon attaining age 65 or becoming Medicare eligible, there are currently 4 plans available. 2 plans, both Medicare Advantage plans, are available only to those residing in New Jersey. For retirees living outside of New Jersey, there are only 2 traditional indemnity options available. Select Line and Choices employees who are eligible for a PSEG subsidy toward the cost of retiree healthcare coverage will pay based on the following table. The subsidy is also referred to as a retiree cost factor and is determined by your years of service and your final base pay at the time of retirement. Let's do a brief overview of how Medicare coverage works upon attaining age 65 or becoming Medicare eligible. There are 2 parts of Medicare. Part A provides hospitalization coverage and is offered at no cost. Part B provides coverage for doctor visits and durable medical equipment. There is a cost for Part B, and enrollment is required. Supplemental coverage is offered to Medicare-eligible retirees to address coverage gaps. Currently, your supplemental coverage is the benefit plan sponsored by PSEG. In the Medicare marketplace, supplemental coverage options include Medicare Advantage plans that look much like HMO and PPO plans. They generally include prescription drug coverage and sometimes are referred to as Medicare Part C. Also available is a Medigap plan. A Medigap plan offers medical coverage only and picks up those costs not covered by Medicare. When choosing a Medigap plan, you may also need a prescription drug plan or PDP plan, which is commonly referred to as Medicare Part D. Currently, under the PSEG plan-sponsored healthcare delivery model, the company offers the supplemental group-based coverage and retirees are contributing toward the cost of that coverage. The current model presents us with some challenges. Limited plan choice. 2 of the 4 plans offered are limited to New Jersey residents only. The existing retiree population includes 30% who permanently reside outside of the state, and there is a number that reside in the state part-time. This limits their options to only 2 plan choices that have national coverage. The PSEG enrollment of our retiree population is decreasing and will continue to do so over time. Those employees who may be eligible for subsidized retiree coverage is approximately 25% of the active employee population. The average age of our retirees is approximately 80 years old. This declining enrollment is shrinking our insurance pool and increasing the PSEG plan cost at a faster rate. As the cost of coverage increases to PSEG, so does the retiree cost share. The current administrative arrangement offered to PSEG retirees does not provide decision support on choosing the right plan or help with claim issues that may arise. Many retirees are looking for coverage features that appeal to their active lifestyles, geographical locations, and available community resources. Let's take a quick look at how increases to the PSEG plan impact retirees and erode their pension benefits over time. As the cost of the plan increases and the cost of healthcare overall increases, you can see by this chart how it can steadily impact the pension benefit over the course of someone's retirement. For example, although you may only be paying 15% of the PSEG premium, that 15% is increasing each year. The future state of delivering health care for Medicare-eligible retirees will provide a more customized and personalized approach. PSEG will no longer sponsor supplemental coverage, but instead provide an annual contribution towards the cost of retiree health care into a health reimbursement arrangement, or HRA. The Medicare-eligible retirees and applicable dependents will use this contribution to purchase a Medicare supplemental plan in the Medicare marketplace. They will receive assistance from Via Benefits, a Medicare marketplace administrator. The new model will allow them to choose a plan that meets their individual healthcare needs, lifestyle choices, and provide coverage to meet the diverse geographical footprint of PSEG retirees. In addition to choosing a medical and dental plan, they will also have other ancillary coverage options such as vision plans, hearing aid programs, and gym reimbursements, to name a few. In contrast to PSEG's shrinking insurance pool, the Medicare market insures approximately 44 million lives today and expects to increase to 79 million by the year 2030. This is the result of baby boomers turning age 65 at the rate of 10,000 each day. The growth of those eligible for the Medicare market is expected to drive down cost, increase plan choices in carriers, and improve innovation of preventive care strategies. The health reimbursement arrangement that PSEG will be funding is a tax-free, non-interest-bearing account. Medicare-eligible retirees and their Medicare-eligible spouse can use the contributions to purchase a supplemental plan and pay out-of-pocket health care expenses. Balances left over at the end of the year will roll over into the following year for future expenses. Beginning on January 1st, 2021, PSEG will contribute $4,120.90 for medical and $412.09 for dental into an HRA for all Medicare-eligible retirees and their Medicare-eligible dependents. Each year after, the amount contributed will increase by 1.5%. For example, on January 1st, 2021, a Medicare-eligible retiree and their Medicare-eligible spouse will receive $9,065.98. This amount will be used to purchase a marketplace plan for the retiree and spouse and cover any out-of-pocket expenses they may incur. In the following January 2022, they will receive a contribution that will be escalated by 1.5%. Let's see how the future enhanced delivery model looks against our current one. You will see by the illustration that a retiree and spouse electing a plan meeting their individual healthcare needs and geography will spend less in total cost. The HRA contribution provided by PSEG will cover the cost of their plan, and there will be remaining funds to carry over. Some additional enhancements to this new delivery model include using your HRA balances to pay for other eligible healthcare expenses, and the annual HRA contributions will be available each January, and surviving spouses will be able to keep the HRA rollover balance after the death of retiree, even though future contributions will cease. This enhanced delivery model for Medicare-eligible retirees is a win-win for all. Retirees will be able to elect health care that is personalized with more choice and in many cases have equal or better coverage while experiencing cost savings. For PSEG, the future costs and obligations will be more predictable and controlled. Now, let's take a deeper look at the value of the Medicare marketplace. The Medicare marketplace offers choice from over 100 different healthcare carriers. PSEG retirees, regardless of where they live, will have on average access to more than 50 plans. Each year, retirees and their eligible dependents will have an annual enrollment period in which they can change their plan. Overall cost trend in the Medicare marketplace over the last 10 years has been significantly better than the PSEG sponsored plans. Based on our current retiree geographical footprint, 99.5% of PSEG retirees have access to a $0 premium plan. What is most important about the marketplace is that a licensed benefit advisor will assist each retiree with the selection process, helping that retiree find a plan that best meets their individual health and financial needs. This is a sample of the geographical footprint that we used during our analysis. You will note the highlighted line showing the available plan options in Ocean County, New Jersey. For the 705 retirees residing in the county, you can see they have access to 11 Medicare Advantage, 42 Medigap, and 18 prescription drug plans. Monthly premiums range from $0 to $365 per month. Via Benefits, a Willis Towers Watson company, is the Medicare Marketplace Administrator PSEG has selected to provide this delivery model. Retirees and their dependents will engage in a consultative process with an objective licensed benefit advisor who will walk them through the selection and enrollment of their individual plan. After the enrollment process is complete, Via Benefits will continue to be available for any issues that arise, including claims, locating a provider, or reimbursement from the HRA. Via Benefits is not new to the Medicare marketplace. They are 1.8 million members strong and have been offering this service for more than 12 years. There are a number of companies that have joined their marketplace over that period of time, and this growth has allowed them to enhance and innovate their services. PSEG will be joining over 30 utilities that are offering Via Benefits covering approximately 150,000 lives. In January 2018, we introduced Via Benefits to our Medicare-eligible surviving spouses of retirees. Prior to this move, after the death of a retiree, a surviving spouse would pay 100% of the PSEG healthcare premium. Moving to Via Benefits provided the population significant savings by reducing their monthly premiums. Another enhancement was allowing Benefits 2,000 Medicare-eligible retirees and dependents access to the marketplace through Via Benefits. Feedback received from both groups has been overwhelmingly positive. Although the effective date of this change is January 2021, we will be working throughout this year and 2020 to ensure a successful transition for retirees and their dependents. It is our goal to educate this group on the upcoming changes throughout 2019 and begin sending enrollment communications in July 2020. Thank you for taking the time to learn more about this enhanced Medicare-eligible retiree healthcare delivery model. If you have any questions regarding this change, please visit mypsegbenefits.com.